All right, welcome. This is Telemedicine Webside Manner Tips and Tricks with Jason Lowe and David Howe. Thanks for being here. Not going to be too long, I promise, and hopefully you'll learn something on the way. So telemedicine is here. Telemedicine is here and it's here to stay. Yesterday, I was in the PZD, and I was the one that was lucky enough to be there when they brought in the 24 final iPads that fill out our full complement of telemedicine units for our emergency department. So 300p and 500p. All the rooms now have these iPads in them. Each of these iPads has Zoom loaded on it. And Zoom is the same teleconferencing software app that we use for our meetings. We just used it today in the town hall, and that's the same familiar software that you guys all know that is on the iPads. They all have the same directory on them, and it's very easy for them to talk between each other. Now, Ryan Rivera, our colleague, has already made a video that demonstrates very quickly and easily how to initiate a call between each of the iPads. Thanks, Ryan. So, now that that's done, we're ready to go, ready to do telemedicine. So this kind of quick crash course will serve as an overview to point out some of the subtle differences between in-person versus telemedicine history and physical exams. Because you guys are already probably familiar with FaceTime with Aunt Edna, hi Aunt Edna, and you know how to use video conferencing software. So with just a few tweaks, you're going to come away with a very complete history and physical exam. It's going to be fantastic. If you stick with me through this thing, and it's not long, I promise, I'm going to leave a little Easter egg at the end. Here's a preview of what it is, though, to pique your interest. Social distancing. So, goals in the time of Corona. We want to decrease exposure. We want to increase efficiency. We want to reduce the amount of PPE that we're consuming. It's crazy how much we're using, really. And telemedicine is an elegant solution to all of those. At the same time, we want to continue giving quality care, right? So with that in mind, here's the setup. You need to think about lights, you need to think about sound, you need to think about camera, and you need to think about action, what you're doing in front of the camera. So these are the things we're going to go over right now. So lighting, right? It seems obvious. You really need to make sure that the patient's room is well lit with all the lights on. Sometimes they'll go and turn them off, or the nurses will turn them off. Turn them on. Ask them to turn them on. Same goes for you. Make sure you are in a well-lit area with all the lights you can on. The reason why is the iPad has a small sensor. It can't grab that much light. So the more light you give it, the better the picture will be, the sharper it will be. The other thing to be mindful of is backlighting. Make sure that there's no bright light behind you, and the picture will also come out better. Now you can see here that the light is behind David and his face is entirely dark, and that's not what you want. Try to avoid backlighting like this. Sound. Sound is important. It's easy for me to say this. RED is very loud. There's HEPA filters now. There's monitors dinging. There's nurses talking. There's phones ringing. It's loud. So really try to get into a quieter area if you can, because it's going to make a much better experience. Poor sound equals failure a lot of times for telemedicine. If you can't hear what the person's saying, you can't get a history. So here's an example of what I mean by ambient sound absolutely destroying the quality of the telemedicine interaction. So for camera setup, you want to make sure both lenses are clean. If you have a blurry picture, it might just be that you need to wipe off the lenses. You also want to place the iPad at eye level. So remember, if it's horizontally configured, the lens is going to be on either side, and if it's vertically oriented, the lens is going to be at the top of the iPad. In terms of your placement, try to put yourself right in the middle of the screen with your face, neck, and trapezius showing. You don't want your shoulders in the frame. That means you're too far away, and we're going to see that in 1 second. So, this is too close. This is getting away a little bit too far. And this is about just right. Notice his head, neck, and trapezius are in there. Good job, Dave. So for action, what you're doing in front of the camera. Something to be cognizant of is to look at the camera lens, which I mentioned is going to be on either side of the iPad, depending on how you have it oriented, or it's going to be on top if you have it vertically oriented. Other things to note are to talk 25% more loudly and slowly than you're used to. Really just enunciate your words, especially since we're using medicalese. It's going to be easier for the patient to understand you and facilitate communication. Be clear. So you see here, this is Dave looking at the screen and not at the lens. He's kind of looking off to the side, and that's the impression that the patient's going to get, that you're not looking at them. So you really want to look at the lens.
Smile. Great.
Other points to consider are to make sure your teeth are clean, right? You don't want to have anything stuck in your teeth. Wear a white coat or scrubs. Try to look like a doctor. Since you're not there in person, you want to really give the appearance and aura and presence of a physician. And society's cues are white coats, scrubs, perhaps a stethoscope around your neck. These are all cues, visual cues, that tell the public, hey, this is a doctor I'm talking to. This is not a nurse. This is not some random person on the street. This is a doctor. Also, thing to remember is that the camera magnifies your actions. So don't have gum, don't have food, don't be drinking. This kind of goes without saying, right? But just be professional. So now that you know how to act in front of the camera and how to look in front of the camera, now we get to the history and physical exam. So I threw this up here because I wanted just to emphasize how important history taking is. This is an article from the British Medical Journal, 1975, Dr. Hampton. They took 80 patients and they let physicians try to come to the correct diagnosis via a history physical exam in labs. So 83% of the time, the physicians were able to get to the correct diagnosis with just the history. So I just wanted you to keep that in mind. History is key, and you can get a great history via telemedicine, probably the same history that you would get in real life in front of the person. So don't rely so much, or don't think you have to rely so much on the physical exam and getting tests in labs. History is money. As far as the physical exam goes, we're going to use the physical exam that comes in the COVID-19 template. So you can choose that within Epic, and it has a virtual exam selection option. And this is what it looks like here. It has physical exam, vital signs and nursing, constitutional, HENT, pulmonary, musculoskeletal, neurological, and psychiatric. Okay? So for general appearance, you can say that someone's active alert, no distress, and non-diaphoretic. If they aren't any of those things, then maybe you should switch out of a telemedicine visit. Perhaps they were mistriaged, and that's okay. You can always abort a telemedicine visit and feel free to go and see the patient in person. And for your HENT exam, you can look at the head and say it's normal cephalic, atraumatic. You can assess the pupils and note that they're equal and round. You might not be able to get reactivity, and that's okay. And for extraocular motion, you can ask the patient to look up, down, and left, right. You can also be noting if there's discharge or erythema or injection of the sclera. Hey, can you help me examine your eyes now? Great. Can you move a little closer to the camera? Perfect. And now can you look up, look down, to the left, and now to the right? Great, perfect. Thank you. So the nares are relatively easy to assess. You can ask someone to just breathe close to the camera to assess for patency. And if you wanted to, you can include things like no epistaxis or no foreign body. And for your oropharyngeal exam, you're going to want to ask the patient to open their mouth wide and move closer to the lens or the camera. Their first instinct will be to move closer to the screen, which won't get you a good view. You want to ask them to move towards the lens.
Okay, Natasha, I'd like to look in the back of your mouth if that's okay. Can you do that?
Yes.
So what we need you to do is open your mouth really big and move closer to the lens of the iPad, not to the screen, but to the lens. Okay? Go ahead and do that. Perfect. Stick out your tongue. Great. Thank you. That's good.
And for your cardiovascular exam, take a look at the vitals and you can say that the pulse and blood pressure are normal. You can also look, if they're on a monitor, you can say that the rhythm is regular on the monitor. And you can ask them to help you assess their perfusion by looking at the skin and seeing if it's pink and well perfused. And they can help you with capillary refill. You simply ask them to do it.
Okay, can you go ahead and press your palm and hold it and then let go? Go ahead, let go. Perfect. Can you do it one more time? And then let go. Awesome. Thank you.
For your pulmonary exam, obviously you're not going to be able to auscultate, but you can say that they have normal effort and they're in no distress. You can also say there's no auditory stridor, grunting, or wheezing. The patient can also help you out with your abdominal exam by assessing for tenderness. You can simply ask them to use their own hands, or you can ask a parent or guardian to use their hands, and palpate the patient's abdomen and tell you if it's tender or not.
Do you mind helping me? We can see if your abdomen is tender.
I can help you.
Okay. Can you press on the right upper portion of your abdomen with your hand? And tell me if that hurts at all.
No, it doesn't hurt.
What about the left upper portion of your abdomen?
No, it doesn't hurt.
The left lower portion?
No.
Feeling okay? All right. One more spot, the right lower abdomen. Does it hurt there?
No.
Can you press a little harder? No? It's feeling okay? Okay, great.
It's okay.
And for your musculoskeletal exam, you can ask them to move their extremities for you. You can ask them to ambulate. You can also state there's no deformities if there are none. And finally, getting to the end of it, we're talking about the neurologic exam. You can say that they're alert and oriented if they've been cooperative with you through the exam and through your history taking. You could say their GCS is 15.
Can you tell me your name?
Hi, I'm Dave.
Where are you, Dave?
I think I'm in Stanford.
Do you know what day it is?
Oh man, I think it's Doctor's Day.
And that's that. Thanks for sticking around if you made it this far. Like I said, it was a crash course that we just put together over the weekend, and I hope it was helpful. I want to give special thanks to Peter Baumeister, Ivan Mock, David Howe, Melissa Hirsch, Natasha Kang, Chi-Chen Kui, and Onur Appreciate your help, guys. Let me know if there's anything that I needed to change or add or glaring errors. As I promised, if you stuck around, you'd get a little Easter egg, so wait a second more if you want. You can watch that. If not, sign out right now. Appreciate you.
Quarantine, drinking whiskey like vaccine. Waving that